The Executive Secretary, Osun Health Insurance Agency, Dr. Razak Akindele, has said that the agency has begun processes to go on full automation, adding that this will not only reduce the use of paper but also make operations easier for the agency. Akindele further noted that the agency will also introduce a mobile application, which is in a bid to promote and enroll more residents into the health scheme and in compliance with global trend. He made this known during the first quarter of the forum meeting held with healthcare service providers in Oshobo on Friday, adding that the mobile application will be an efficient tool in gathering of residents and information.
Yes, yes, we said we're going to automate our system so that we reduce transfer of papers, hard copies, and things like that. Quite a lot of people are going to be able to do things on their own. We'll have an OSHA app that you can download from Google Store, from Samsung Store, and all the rest. And you can do anything there. You can do registration on it. You can pay for your premium on it. The hospitals can manage the hospital on it, do their claims on it, and of course, we will. So we are going to automate our system, and anybody, anywhere in the state, can get things done without necessarily visiting our office. Claims management, payments, everything is going to be online. We are really working hard to get the informal sector. We are using all forms of publicity that we can, the print media, the electronic media. We are even going door to door to let people know what benefit they stand from getting from enrolling into OEs. And we have been getting response. In the last 3 months, we have had about 8,000 people coming to join us on board. So that's a good response. If we can sustain that, that would be good for the agency.
The Executive Secretary also stated that the pensioners' registration have started in December and will continue till January and February 1st, 2024, and they will start accessing health care free of charge.
We know we started the registration of pensioners in December, and we have done that December, January. By February, we want them to start accessing care free of charge. That is the aim of the governor, Senator Adeleke Nurudin Ademola, that all the pensioners should be enrolled so that they can have free health care. So we're going to start their care from February 1st, and that's what we have just informed the providers, that once they start coming, they should start giving them care. No, so there is the T-ship program for students across all the tertiary institutions in the state are supposed to key into this and get all the students registered into this T-ship. We have that program for them, and it's running. The major constraint anywhere now is fund. You understand? So part of the constraint we have is fund, and that's why we're trying to reach out to as many people as possible, stakeholders, and even enrollees, to come and join us so that we can have a big capital base, we can expand our scope, and increase the capitation tariff and the fee for service.
Dr. Adeyemo Adekunle, representing the State Coordinator National Health Insurance Agency, commended Osun Health Insurance Agency for always being a shining example for others to emulate. He also added that the percentage of informal sector receiving quality health care will bring in more people to key into the program.
All right, let me quickly say this first, that let's appreciate the wonderful work that the Osun Health Insurance Scheme is actually doing. They started well, and they have been able to consolidate on those efforts. Now, in answer to your question, I think number one thing we have to do with confidence of our people. The people that beneficiary most from this is the people in the formal sector. The people in the formal sector, they're like automatically, they're automatically, engaged into the system. Now, if you have the confidence from those people in the informal sector, those people that goes to the hospital from the formal sector, their experience with the health providers, their experience with accessing care, when they find it so easy and they get that they are getting the quality health services, this will navigate and this will actually push more people who are in the informal sector to actually want to key into the program. Like we said, that health insurance should be free health. No, not totally free, because health insurance is actually being paid. A premium is being paid for one person to actually enjoy the benefits there. So when they go to the hospital, get the best of services, this will actually drive them to actually, publicize it and sing the song aloud, so that a lot of people can actually want to key into, people that are artisans, people that are, into the informal sector. They give them that drive, that will to want to join into the health insurance program.
Or the providers, they will tell us. And some of the things we expect, we have said it here. That's what brings it. And it's going to be a continuous process. This is the first quarter of the year. We're going to have another in the second quarter. And because we are going automatic this year, there will even, apart from this, there will be training sessions.
Some of the healthcare service providers who spoke with newsmen commended the agency for the providing conducive platform to be able to address the issue the healthcare service providers are facing and providing the solutions to
Our
it.
relationship with OSHA, I think, has been perfect. They have a way of relating with you with human feeling. There's respect. Not that because they are just the agency at the top. There's a lot of respect that comes from the relationship, and they're always there to answer to your concerns and questions promptly. I think it's what they practice.
Shola Ishola, Afes TV News.